I think one of the refreshing things was I quickly realized I'm not alone in what I face being a smaller rural facility. The workforce shortages, running some outdated systems just because you have to, it's the only option you have, and the funding constraints.
Hello and welcome to Healthcare Strategies. I'm Jill McKeon, Associate Editor of Health Tech Security. Today we're joined by Jim Roeder, Vice President of IT at Lakewood Health System, a nonprofit rural healthcare system in Staples, Minnesota. Welcome, Jim.
Thanks for having me.
So today we're talking about cybersecurity challenges that come along with being a rural healthcare organization. For some context, our guest, Jim, recently served as a co-lead on the Health Sector Coordinating Council's resource-constrained provider cybersecurity task group. So this task group interviewed 42 executives across 31 states from entities such as rural and critical access hospitals, small physician practices, and federally qualified health centers. They conducted these interviews to learn how resource-constrained entities approach cybersecurity and what kind of government and community support would really help them bolster their cybersecurity programs. HSDC delivered these results to HHS, the White House, and the House and Senate Rural Health Caucuses in May 2025. So we'll be discussing the results of that report as well as the challenges that rural and under-resourced healthcare entities face on a daily basis. So to begin, Jim, as VP of IT at a rural healthcare system, what are some of those unique challenges that smaller rural healthcare providers face compared to their larger counterparts?
Yeah, I think the main thing that the smaller ones kind of face that we heard in the interviews and speaking from our own lens is we lack some of the dedicated IT staff that they typically have. Like they have a lot of your CIOs, CISOs, network admins, system admins. When you start looking at these smaller facilities, they either have a person doing 3 or 4 of those roles, or they have a lot of like your virtual services or an MSP helping them out. The other thing too is they typically lack the financial resources that the larger ones have. And so then that comes out to play. The smaller ones are usually working with outdated technologies. They're not able to upgrade to the newer things or have some of the higher end tools that the larger ones have. And so they're typically a little more vulnerable to cyber threats because of that. And then just it's hard for them to make sure they're securing everything the way they should, which, that can come in. The patient data is more apt to be hacked, or even their clinicians have a harder time having remote access and doing even remote care. And so I think that's where you see the smaller facilities at the disadvantage compared to the larger ones. Not to say we're all facing the same realities of the threats that come with it, but it's just, in my mind, the rural and smaller facilities are probably a little more susceptible to it.
For sure. And like you said, these entities are all facing lots of cyber threats on a daily basis, but the smaller ones might have more funding and workforce challenges to really combat those threats effectively. So we previously mentioned the HSCC task group that you were part of. You interviewed 42 executives from various resource-constrained healthcare organizations. Were there any really surprising commonalities or differences in the challenges reported across this diverse set of organizations?
Yeah, I think one of the refreshing things in doing it was I quickly realized I'm not alone in what I face being a smaller rural facility. A lot of them had the same themes that they're the workforce shortages that we face, running some outdated systems just because you have to, it's the only option you have, and the funding constraints, whether it's your operating and capital budgets or the reimbursement strategies that are available to you. Those are similar to all of them that we talked to. Some of the differences that jumped out on me was that what we prioritize as the number one things we have to do was maybe 3 or 4 on the list at another one, where they're looking more at making sure that they're ready for disaster recovery or business continuity. And maybe we're focusing more on the risk and compliance side of things. The prioritization of things was a little different for everybody we talked to, but it was probably on their list, just not as high or as low as other ones.
Yeah, it's interesting to see in that research how different organizations approach prioritizing certain cybersecurity and compliance activities, given their limited resources. So I'd like to dive into that more, talking about the cybersecurity workforce shortage, which I know has impacted organizations not just in healthcare and not even just in rural areas. It's a widespread issue. But I'm curious, from your perspective, what are some challenges that come with attracting and retaining cyber talent in a rural area or at an under-resourced healthcare entity? and also what incentives might help attract cyber talent in the future?
Yeah, I think some of the challenges are around typically your rural areas are going to have lower salaries. And it takes person wants to live in kind of that geographic location. Are you comfortable being 30 minutes away from restaurants to go eat at or activities to do with a family? That, and then to one we run into a lot is I look at like my system admin started here probably 15 years ago and probably will work here another 10, 15. And someone that wants to move into that role or have some career growth, it's not there because there's limited job roles and limited opportunities kind of in the rural area. The things we've tossed around to try to help attract talent to come in is, can there be some sort of rural loan forgiveness for their student loans? If they go into cybersecurity and they work in a critical access or a rural emergency system, can that be forgiven somehow through the government? Much there is programs for providers if they go into that, the RPAP program, for instance. And you look at remote work opportunities, sometimes that's a blessing and a curse for us because yes, we can offer that to work remotely, but also at the same time, someone living in this area now could work for a big urban company and get the urban salaries. And so it goes both ways on something like that. But those are what we look at for ways to try and help out.
So there's a barrier to entry for some of these prospective employees, maybe a barrier to growth in those roles. And then there's also the competition for other higher paying jobs in different regions.
Yeah, exactly.
It's definitely a complex issue for sure. So I think it's fair to say that amid these workforce challenges, a lot of healthcare, IT, and cybersecurity teams probably don't have the ideal amount of resources across the board. So that might mean that one person's doing the job of 3 people or however it might work out. So how does the reality of staff wearing multiple hats in a smaller healthcare organization impact your approach to security planning?
Yeah, like I mentioned before, like we have to wear sometimes 3 or 4 different hats and do different job roles. I think the problems we're aware of with that or that we got to be cognizant of is we're not able to dedicate that time to cybersecurity all the time. Or it'd be lovely to have someone that's reviewing our logs and checking on things and any alerts every day in their role. But the truth of the matter is sometimes they only have a half a day or 8 hours of their 40-hour work week that gets dedicated to that. And so sometimes you get those gaps in oversight. And so anytime you can have some sort of automation or framework to follow, that some guidance like that goes a long ways. And you have to sometimes start weighing that. Okay, what would it cost for me to outsource this? Can I find a company to do these 2 or 3 things for X amount of dollars that's cheaper than hiring someone, and I'm able to not have to worry about whatever those gaps are and can sleep better at night because I know it's being managed and looked at.
Yeah, I can see how being able to outsource some of these functions would be really helpful in just reducing that burden across your small team. And I know that we've already discussed this a bit, but funding for cybersecurity really remains a bottleneck for a lot of these resource constrained entities. I'm curious what strategies have proven most effective when trying to advocate for cybersecurity funding to leadership and board members when there are competing priorities.
I think the biggest thing I always try to do is try to relate it to like patient safety and trying to make sure we're taking care of our patients, securing their data. And then just if we don't implement said product or said strategy, what's the risk we're willing to take on or that we're going to have to be comfortable with? And just trying to show that to them so they can have an understanding of, yes, okay, we're not comfortable spending $100,000 on this software or whatever value. By doing so and saying, so this is the risk we're going to take on and be aware of. And when there is that risk taken on, coming back to it even in 3, 6, 9 months and saying, are we still comfortable with this? If not, here's the opportunity we have or what we can invest in or implement to take that risk and get rid of it. But at the end of the day, the biggest thing I always try to do is relate it back to our patients and their care.
For sure. And that's a big theme in this sector, I think, is that cybersecurity is a big aspect of patient safety. So being able to communicate that to the board. And I often hear the predicament of a hospital choosing between an MRI system or a cybersecurity software, things like that. So it's certainly a tricky situation for these entities. I'd also love to talk about the role of vendors. I know that they're such a critical part of any healthcare organization's ecosystem and they're valued partners, but they can also expose these organizations to some third party risk. So, given the resource constraints that we've discussed, what are some of those approaches for managing third party risk as a smaller provider that might not have the resources to oversee however many vendors they're dealing with?
Yeah, I think that's a big challenge for the smaller facilities. It's hard to do that continuous monitoring of your third parties, always knowing what's going on, asking them, have they done their due diligence? Can they provide reports? I think anytime you bring on a third party, it's vital that you do some sort of risk assessment with them, whether that's a homegrown spreadsheet that you use within your facility or it is a software that can help manage that. I think that's important that you go through that and make sure that's in place. One of the things that came out too when we did the interviews with the Health Sector Coordinating Council was a lot of the facilities said they want to see a shift where today, typically the vendor doesn't have to take on any of the risk. If we can get to even 50-50, there'd be a lot of leaps and bounds that we could gain and help implement more cybersecurity and have them take on that risk, make sure things are getting updated, that things are set up the way they should be. Hear about it all the time that things are implemented in the default admin user and password are just left. And it's just little things like that where they can help go through and, okay, this is what it is, but make sure you change this before we go to production. Things like that would help.
For sure, making it a shared responsibility between the vendors and the system owners, things like that would go a long way. Would you say that's not the norm at the moment for that to be a shared responsibility?
Yeah, we're not there yet. I will say if I look back 3-5 years ago, the shift has already started happening, which is great to see.
Great. Yeah, and I know this was mentioned a lot in the HSCC report, just the role that different industry associations, vendors, government agencies can play in supporting cybersecurity at under-resourced healthcare providers. So I'm curious your thoughts on the role that these organizations can play and how subsidies and reimbursement incentives could also help fill the gap for these organizations.
I think if somehow they could come together and whether it's obviously funding always helps. I don't think any small rural facility would turn it down, but even something as simple as training, helping end users understand the risks of clicking on things in emails, things like that. We all typically do phishing tests now, and then even training your IT staff, I think would be great. A lot of times you recruit talent and they have to take on all those roles. They're learning on the job, learning as they figure it out. So any training that could help or even help us kind of, okay, here's the NIST framework. Here's how you can relate it and implement things within your facility, helping us understand that and get those things into place. And then if there's any reimbursement or subsidy, any type of incentive that could help offset security upgrades. So you have that framework. Okay, we got to implement some sort of detection and response technology. Okay, if you do that, we'll give you some sort of extra reimbursement or bonus payment instead of you got to have this or there's a haircut off your reimbursement. Try and get more to the bonus side of things for implementing the right things.
For sure. And I could see how incentives would go a long way when you're making that choice between priorities. If you're able to get some funding back for good cybersecurity, that would positively incentivize people to take those actions. And it's interesting, you also mentioned the cybersecurity workforce training across the organization. Another instance of shared responsibility for cybersecurity, because we know that it only takes one employee to click a bad link to start a cyber attack. So that's a really critical piece of the puzzle there. I'm curious also what practical advice you'd offer to IT leaders at similar organizations to yours who are trying to balance security needs against operational constraints.
Yeah, that's a good question. Something I always try to make my peers aware of. And as I talked with even the ones in the interviews we did was there's a lot of free resources out there now. And there's more and more that become available. Like the Health Sector Coordinating Council, we publish different reports to try to help them, training videos that they can leverage and give to their employees. CISA does a lot of stuff depending on what vertical you're in. For example, like the healthcare vertical, they'll do external testing of like your IPs to make sure you know what vulnerabilities are out there, things like that. If you're not taking advantage of them, try to do that. Collaboration's a big one. We've touched on that. local health systems or things like that. Find out what they're doing. Can you do that? Or can you share some resources? Prioritizing what you want to work on, trying to focus on what's the biggest risk we have here that, for a cyber attack, and how can we address that? And then probably like that mantra we talked about, it, cyber safety is patient safety. We talk about that a lot on the Health Sector Coordinating Council, and that's the slogan we utilize on a lot of things, but that's really what it comes down to.
Definitely. That's great advice. So we know that resources are really minimal, but there are resources at a low cost or no cost that can help these organizations improve their security posture and smartly prioritize risk management tasks. So really appreciate you joining us today. It was a pleasure.
Yes, thanks for having me.
And thank you, listener, for tuning in. If you liked what you heard, head over to Spotify or Apple and drop us a review. We will be choosing some of our reviews to be read on the show in appreciation, so keep listening through to the end because you might get name dropped. See you next time. Music by Kyle Murphy and production by me, Kelsey Waddell.
This is an Informa Tech Target production.